Is vision covered under Medicare? The answer is sometimes yes and sometimes no. Hello, this is Kathy Bukowski. I'm the owner of CB Health Insurance and the CB Health Insurance YouTube channel. If you are new to our channel, please, I encourage you to subscribe. Hit the subscribe button and make sure you hit the little bell so that you can get future videos as we post them about twice a month. Feel free to share and like our videos and tell your family and friends. Now, back to today's topic. Does Medicare cover vision? Okay, and sometimes yes, sometimes no. So what are we talking about? Well, what does Medicare cover? Medicare does cover some vision services. For example, a yearly eye exam is covered. Also, cataract surgery, glaucoma test. Any disease, including macular degenerative eye disease, as well as diabetes. Of course, if you get sick and you have pink eye, or if you have detached retina, or any of those things are going to be covered under Medicare. And if it's an outpatient service, it's going to be covered under Medicare Part B, which most is. Now let's talk about cataracts, because this is very common in older individuals. And I'm told, because I took my mom to the doctor 2 years ago, and she had the cataract surgery. She was on Medicare, and the doctor explained that as you get older, the lens in your eyes actually goes bad, and so it needs to be replaced. And that's what cataract, and you start to get circles at night. So it's very common, and this is covered. Just the replacement of the standard lens is covered by Medicare. It's done on an outpatient basis. However, oftentimes the doctor will ask you, as they did my mom, would you like to have the ability to see both far and near without having your cheater glasses on? And I had learned in advance, so I told my mom the answer, hey mom, this isn't covered by Medicare and you have to pay for it. So we asked the question, how much is the cost? And it was about $800 an eye, and I've heard as high as $1,000 or more. And she said, no, thank you. I'm fine wearing my glasses. So the standard lens that's going to allow you to see better, that's covered by Medicare. This is an outpatient surgery. You do have to have somebody drive you there, but it is covered under Part B. And of course, if you have a supplement, that supplement is going to pick up a lot of the co-insurance after the deductible. So that is covered. Now let's talk about what's not covered. What's not covered under Medicare is what a lot of times people think of when they think of vision coverage or vision insurance. That's going to be an annual eye exam so that you can get prescription lenses. I'm not talking about the cheaters that we buy at the dollar store. I'm talking about prescription lenses. So that eye exam, not the annual one, that is going to prescribe what prescription, that's not covered, okay? Also, your glasses aren't covered. Also, your contacts aren't covered. So a lot of people will ask, how do I get this coverage? That's a very good question I'm going to answer. There's two ways you can get vision insurance or vision coverage. The first way is if you are on original Medicare, Part A and Part B, and you have a supplement and a drug card, which a lot of people do, you can purchase individual standalone vision insurance. And there are a number of vendors out there. VSP is one of the nationwide providers, and I'm actually going to show you on my website how you can go get a quote and see what the benefits are. Okay, so I'm going to show you, if you go to my website, CB Health INS, type that in, and it pops my website. On the far right is a self-serve tab. If we hover over that, there's a drop down. We want to select individual vision. On this page, you'll see there are two options, VSP and direct vision. We just click on these buttons here. So let's look at the VSP. What loads here on the very top of this is an example of what happens if you went for an eye exam and you got a pair of glasses with the lenses, how much it would cost you. With a VSP plan, on average, you're going to save $278 a year, assuming you go to a VSP doctor.
So what are my options? There are 3 plans, a base, an easy option, and a standard plan. And you'll see the difference in benefits. If I scroll down, there's actually a brochure that we can download and take a look at more details if we're interested in. But here you'll see that most of them have they all have a $15 copay for an eye exam. Your basic lenses, which is the glass part of the glasses, is going to be $25. And then you get a $150 allowance towards frames and a $150 allowance towards contacts. Notice if you did both of these things and had an eye exam, your benefit is actually going to be over $300 a year in benefit. So the question is, how much does this cost? So glad you asked. We're going to click on Get Rates. Of course, we have to choose our state, and up pops the rates for all the plans. You'll notice there's an option for 1 person, 2 people, or 3 or more. So a husband and wife can enroll together, or if just one of you needs glasses, you can choose this plan. The base plan is going to run $180 a year. Now remember, on average, you're going to save over $278 in value, and most likely over $300. If you want, you can choose a monthly option, and we can go ahead and enroll right here. You'll notice there is this item that pops up mentioning this annual membership fee. This plan is actually available through an association, and you do have to belong to that association in order to enroll. But it's only $18 a year, which is $1.50 a month. So if we continue, you're going to see the monthly price right here. And if you want more details, just click on what is this. You'll see that this is a membership that gives you discounts on car rentals and flowers and this Gym America membership, as well as a 24-hour nurse hotline. And again, you cannot buy the plan without enrolling. So all on one website, you can choose the individual plan, you can look up a doctor here, and you can enroll. And this is all done from my website.
So that's the first way you get vision coverage, is you can buy a standalone dental insurance plan, and you can do that right on our website. You can sign up, you can enroll, and that's why we have it under the self-serve tab, because it's that easy. The second way that you can get vision coverage, true vision insurance coverage, is on a Medicare Advantage plan. You have to have A and B, okay? And you want to look at various plans because some of them have included this for free, and some of them it's a rider to get dental and vision. You have to actually pay more money. So you definitely want to look at that and see what the cost is. But most of them have an annual exam covered. Most of them will cover glasses and contacts. Most of them have a national chain of vision providers that you can go to. So that's not a big deal. But you cannot purchase a Medicare Advantage at any time. You have to wait to the annual open enrollment, which happens October 15th through December 7th. That is the time to shop for a Medicare Advantage plan with vision coverage for the following year. You are allowed to enroll during that annual open enrollment. Your coverage begins January 1st, so you can take advantage of the glasses and the contacts. And you do have the option to disenroll if you get buyer's remorse during January, February, and March. So those are the 2 ways you can get true vision coverage. Of course, some things are covered under Medicare if it's medical related, including cataract surgery, diabetes, and an annual exam. But if you're looking for vision coverage that includes an annual exam for prescription glasses or contact lenses, as well as the glasses and the contact lenses, you can either purchase an individual vision plan, go to my website at cbhealthinsurance.com, or you can look at a Medicare Advantage plan. Feel free to email us at info@cbhealthinsurance.com. Again, don't forget to subscribe to our channel, tell your family and friends. Thank you, and stay tuned for the next video.